Welcome back. My name is Dr. Vijay Bhatia. I'm a psychiatrist, and today we are going to talk about what are causes of mental illness. Mental disorder or mental illness is the disorder of the mind, and mind is the overall functions of the brain. So any defect in the brain will cause effect in the mind, and that will cause the mental disorder. The mind or the brain has a number of functions, and these are mainly controlled by a very narrow balance of all the elements, molecules, even simple things like oxygen, water, sodium, potassium, calcium. These are all maintained within a very narrow balance, and other chemicals, neurochemicals, neurotransmitters, and even the receptors. These are the gates for the chemicals to go inside the neuron and function, and they can stop the molecules going inside the nerve cell or let them go out. Without these receptors, nothing can go inside or outside. And these neurochemicals are maintained in a very, very clear, narrow balance. These neurochemicals, neurotransmitters, are being affected by the input from the outside, from the environment. Let's say if you are with somebody you are happy with, there will be neurochemicals released from these neurons to cause that happiness. And if there is a defect in these neurochemicals or these receptors, you will get the mental disorder, things like depression, anxiety. The brain in general is divided into a number of lobes. Frontal lobe, the main function will be attention, focus, concentration, judgment, planning, forward thinking, things like problem solving. So this is important part of the brain. This is the brain highly developed in human beings compared to others. Parietal lobe is mainly to do with what we receive, the senses, all the pain, touch, tactile and other things. Occipital lobe is mainly to do with the visual, temporal mainly to do with the hearing, but part of it is also with the memory, and inside it is amygdala that plays important role in the anxiety and depression. The other inside the brain things are like limbic system, and thalamus is there, which plays important role. Everything from the outside passes through the thalamus. So the nerve fibers from the eye will first enter the thalamus and then to the other parts of the brain. All the tactile, all the sensations, somatic sensations, pain sensations will first arrive in the thalamus, and then it is passed to other areas of the brain. And it is very much, there is like a filter here which is affected by the emotions, these things generate. So if you see something which is scary, that will have a different perception to that person, to another person to whom that thing doesn't feel scary. So it is each sensation coming to the brain has some kind of emotional attachment with that thing, and then that goes into the memory in the hippocampus. Is mainly for the memory. Amygdala is mainly for the fear, aggression, violence. It's highly charged emotions. And all these other areas like cingulate, gyrus, fornix, they play important role in those maintaining the emotions. The other important thing in the brain is the blood-brain barrier. What we mean by this is that in general, in other organs of the body, this is a blood vessel. This has got endothelial cells, and these are not too tightly packed. There are certain pores or passages through which substances can come in and out, and especially oxygen and carbon dioxide, they can flow very easily in and out. But other chemicals can also come out. Even sometimes some immune cells, lymphocytes, white blood cells can also come out and have a little bit more passage outside. However, inside the brain, the blood supply to the brain, these endothelial cells are very tightly packed, so there is no pore literally. So it is very much what the brain need will have that receptor or thing that need to pass from the blood, like blood has a calcium that need to pass into the brain. There will be special pores, there will be special receptors to get that, and there will be like even things like sodium ion. It is inside the blood, but this will not be allowed to enter the blood whenever they want, wherever they want. There will be very specific areas where these things can be allowed. And not only this blood vessel itself, the brain cells itself, astrocytes, they create like these foot-like processes around the blood vessels to cause this extra protection for the brain, so that no toxins from the blood passes into the brain. And these are very tight junctions. However, saying that, there are certain brain areas where these things are not present, and therefore it is more like this one where the things can pass in and out. And there is a reason for that. One is in the pituitary gland in the hypothalamus, where it is required that certain hormones may be easily passed to the blood. Pituitary glands secrete certain hormones. They need to be secreted into the blood so they can pass through these pores into the blood and to other areas of the body. And there are certain other areas in the brain similarly where this blood-brain barrier is not as compact in other areas. Why I'm saying this? Because any imbalance, any toxins like alcohol, cannabis or other substances. Now cannabis is special because it is lipid soluble. They can still come in and out of the brain, of the blood into the brain. So these are going to affect the functions of the brain and can cause mental disorders. So any defect in the blood-brain barrier, some toxic substances cross to the brain, like we talked about cannabis. Some immune cells at certain areas can enter the cell, and they are there to protect the inflammation, but sometimes can cause inflammation, therefore can cause, in fact, confusion and delirium. Alcohol can cross the blood-brain barrier, and other substances like cannabis. What are the causes of mental disorders? So we talked about a lot of biology. So there are a number of causes of mental disorders. It is hard to specify all the causes for all the mental disorders because some of the mental disorders are very specific to certain parts. But here we are talking about in general. In general, when we talk about causes of mental disorder, we talk about the biopsychosocial model. What we mean by that, bio means biological causes of mental disorders, psychological causes of mental disorder. Let's take an example of depression. The biological cause can be that it runs in the family. Psychological cause can be that there has been immediate loss or something which the person cannot bear, therefore going into depression. Social can be something, a person is losing a job or something that can cause mental disorder. So in general, causes of mental disorders are divided into biological, psychological and social factors playing a role either in predisposing that person to have that kind of mental disorder, like depression. They are predisposing the person. If there is a loss of work, to the person that will predispose this person to get into depression or anxiety or other thing. There are certain precipitating factors. When these social factors accumulate to a point where the person cannot continue as a normal person, that will become a more like a precipitating factor. Let's say in this case, social factors, person is losing job. However, he continues for some time in a slightly low mood that is predisposing him, but then the partner leaves him as well. That will be the precipitating factor causing the trigger for the mental disorder to come back. There will be perpetuating factors. If he gets the job, he will probably get better. His financial situation might get better. However, if these things continue, there will be perpetuating factors, which are also known as like maintaining factors. Biological factors. The first one we want to talk about is the genetics. Genetics is what you have been given by both of your parents, and why it is important in the mental disorder. Let's take an example of folic acid. When dopamine is made, it is converted into adrenaline. From tryptophan, it is made into serotonin. But in order to convert this, we need these enzymes, and this enzyme need some coenzymes to help them convert these things. Sometimes the genetics of this enzyme or coenzyme is not functioning properly, and it is causing problem for dopamine to be converted into adrenaline and noradrenaline. So this is a typical example of folic acid being converted into tetrahydrofolate by the enzyme, and then the tetrahydrofolate giving its methyl group and H ions to the tetrahydrobiotarin. So this will cause genetic problem, can cause mental disorder, and normally there is a family history of mental illness. Especially examples will be schizophrenia or bipolar illness or ADHD and many others. If the mother has been using alcohol during the pregnancy or illicit drugs, they are going to affect the brain function of the baby. If the sense organs are defective from the birth and the person is not able to grow up normally, and their perception and other things might be different from other people. There might be previous history of mental illness. Somebody who has suffered depression in the past is much more likely to have another episode of depression, and same applies to schizophrenia and psychosis. Having a long-term physical health condition like asthma, epilepsy, or other problems can contribute towards the biological factors of the mental illness. Any physical cause like head injury or neurological conditions such as epilepsy can have an impact on your behavior and mood, and ultimately causing mental disorder. Damage in utero during pregnancy, not enough blood supply, for whatever reason the mother is suffering from some kind of problems. Oxygen supply to the birth, to the baby, either at the time of birth or after the birth. And food intolerances, we sometimes don't even realize the person might be allergic to lactose in the early period and is in discomfort. There might be some deficiencies of the vitamins like B12, vitamin K. Vitamin K needs to be given right at the time of the birth, and vitamin B1, B6, all these play important role. If they have been deficient for whatever reason, the child is much more prone to get the mental disorders. Psychological factors, things like childhood abuse, trauma during childhood, or even whenever later in life, or neglect, these play a big role because they affect the body. When the body gets stressed, cortisol levels very high, and these cortisols hormones, their function is to control the stress. However, in stress they rise quite a lot, and in effect they can affect the bone, they can affect the ligaments, the muscles, the joints become much more flexible, and can cause problems, clumsiness and other things. So childhood abuse, trauma, neglect affects the amygdala to become overactive. The child will grow as more aggressive, more angry, not able to have the real perceptions because it is being filtered through the emotional feelings. Social isolation, loneliness, experiencing discrimination and stigma, they can be big factors, psychological factors. Social disadvantages, poverty or death, bereavement, loss of loved ones, loss of work, severe or long-term stress, they all will contribute either as precipitating, perpetuating, or predisposing factors for the mental disorders. Unemployment, losing your job, homelessness, poor housing, being a long-term carer for someone, domestic violence, bullying, abuse as an adult, significant trauma even as an adult, like such as military combat, being involved in serious incident in which you feared for your life, or being the victim of a violent crime. Things like post-traumatic stress disorder, acute stress reactions, prolonged bereavement or prolonged depression, they can be a result of all these psychological factors, because these ultimately affect on your self-confidence, in your self-esteem, in your feelings of worth, feeling of helplessness, feeling of hopelessness. These are going to impact. They will be either the triggering factors, maintaining factors, or predisposing factors. There are a number of other factors involved in mental disorders, because we are talking in general, not specific to any one thing. So there will be a number of other things that will affect, including your work, your diet, your drugs, if you're taking illicit drugs, or there are certain prescribed drugs which can cause depression or cause anxiety, and lack of sleep can all affect your mental health. If you experience a mental health problem, there are usually other factors as well. We talked about the biological factors, and the one thing I want to just highlight here quickly is frontal lobe. It is to do the causes like attention deficit disorders. We believe that in the frontal lobe there is not enough dopamine going on. It is hypofunctioning, and therefore the brain is not able to have the executive cognitive functions like problem solving and other things. Therefore, they can develop attention deficit hyperactivity disorder, other disorders like autism, impulsive disorders, conduct problems. In later life, frontal lobe dementia can happen if frontal lobe is not working well. Either there is imbalance, and damage to the frontal lobe by accidents. There is a very good case for the Phineas Gage, who suffered brain injury while he was working on the railway line, and suffered a clear brain injury to the frontal lobe, and later developed personality which was very aggressive and was completely different from what he originally was. Amygdala, this is affected by the stress, fear, and can cause post-traumatic disorder. In post-traumatic stress disorder, it is believed that the amygdala is much larger in the size. It can cause aggression and develop crime and other things, causing anxiety. This is like fear, fight, flight hormones are all here. Thalamus, as we talked about in the beginning, every sensation that is coming from outside is first passed to the thalamus before it is conveyed to the other parts of the brain, and therefore it plays an important role. and because it is very much closely related with the hypothalamus and the amygdala and the limbic system, it filters incoming input from the senses, because if the person is suffering from depression, their attention concentration will be poor, so they might see simple things as threats and loved ones as being not able to trust them. So this affects in a big way. Hippocampus is mainly from the memory. The person might be simply thinking about their past, something has happened to them in the past, and that is constantly coming to their mind and thus causing the mental disorder. It can happen in depression, post-traumatic disorder, and number of other areas. Later on in life, the damage to the hypothalamus will cause dementia, especially short-term memory problems. The other important thing I want to mention is the reward center. This is a cause of mental disorder causing addiction, because what happens is this is the dopamine released in the reward center. This is nucleus accumbens, and this is the ventral tegmental area. And what happens is, with any kind of positive feeling, like you are winning a lottery, you are winning the race, there is a release of dopamine here, and that dopamine is believed to be the factor for the person to repeat that activity, that gives the motivation for the person to keep on doing the same thing to get this dopamine. That should be naturally the way. However, this can be done by number of drugs, especially amphetamines, LSD, cocaine. They will release the same thing here, and the person is getting confused and they want more of those things. So these things can be in obsessive compulsive disorders and in impulsive habit disorders, and especially addiction. It is the main problem to cause the mental disorder. Other disorders can be caused by the imbalance of neurotransmitters like dopamine. Again, we discussed the dopamine in the reward center, but too much dopamine in the limbic system can cause psychosis and even schizophrenia. And we treat this by giving antipsychotics that will block the dopamine receptors gates to help with these patients. And ADHD, we have to give amphetamines in a low dose to help them maintain enough dopamine in the frontal lobe. Parkinson's disease, there is a lack of dopamine in the substantia nigra that is going to the mesolimbic areas, which is contributing towards their rigidity, bradykinesia, and tremors. Other neurotransmitters like serotonin is important in depression, anxiety, anger, aggression. Now, we talked about this reward center, nucleus accumbens. Raphe nucleus is in the midbrain that releases serotonin to the reward center and to the ventral tegmental area, where it is affecting the neurons here, which will release the dopamine in the nucleus accumbens or reward center. So directly and indirectly, this affects serotonin is being affected, and in depression we try to increase the level of dopamine, so serotonin, so that more dopamine is released in the reward center. And similarly, others like arcuate nucleus. This is mainly to do with the endocaphalins, which are like opiates of the brain itself, which will help to release more dopamine here in the nucleus accumbens or reward center. So any imbalance in serotonin will cause the problems and cause the depression, anxiety. There are a number of other neurotransmitters which we are not going to go in detail, because they in itself will need the whole lecture. Things like noradrenaline, as we already talked, dopamine being converted into noradrenaline and affecting the mood, affecting the fight and flight. So adrenaline, acetylcholine is another major neurotransmitter in the brain. Any imbalance of any of these ones, glutamate is the main excitatory neurotransmitter. GABA is the gamma minor butyric acid is the main inhibitory. Cortisol is the stress hormone. Histamine is for the sleep, and there are many more neurotransmitters. Any imbalance of these neurotransmitters or even the receptors they have on the nerve cells, they will be affected and the person become more vulnerable to develop the mental disorder. Thank you for watching this video. If you like this video, please share with your friends, press the like button and subscribe the channel for more videos on the mental disorders.